Hello, this is Dr. John Hoy, physician and surgeon of the foot and ankle, practicing in the heart of downtown Seattle, Washington. Welcome to my treatment room. Today we're going to be talking about exercises to reduce bunions, hammertoes, and flat feet. One of the most common questions that I receive from patients is whether there are exercises they can do to reverse certain deformities such as bunions, hammertoes, and flat feet. And number two, whether these exercises will actually resolve the problem. Let's look into some definitions. A bunion is a prominent head of the first metatarsal. It's a bone that comes out behind the big toe bone, and it occurs when there's a widening of the angle between the first and second metatarsals, which are the bones behind the first two bones, the big toe and the toe next to it. So what happens is the big toe starts drifting towards the second toe, and there's a retrograde pressure on the bone behind it, and the bone comes out at an angle. And a hammer toe, on the other hand, is a bent toe, either the second, third, fourth, or fifth, or even the big toe. Flat foot is a collapsed foot where the arch fails to form. This failure to form may either occur during weight bearing or non-weight bearing. There are different degrees of severity in these conditions. Sometimes the condition is flexible, but sometimes the condition is rigid and not reducible. And these conditions can cause a lot of pain. So a lot of times patients will come and say that they've been doing exercises to stretch out the bunion, pull the first toe away from the second toe, and they've been doing this for years without results. Other patients with hammer toes may demonstrate similar exercises where they do exercises to try to straighten out the toe, but also without success. For flat feet, some patients will demonstrate arch scrunches to try to see if that can actually form an arch. But they still have the deformity and still complain of pain. So patients oftentimes will ask what other types of exercises are available to try. However, with these deformities, which are either genetic or developed over time through various biomechanical factors, there actually are no exercises that can be done to correct or reverse the condition. If there is pain in the big toe joints, such as walking, that is the result of the bunion, a splint can be utilized to straighten the joint and to decrease the pain, or a pad can be put on over the bunion to reduce the pain, but neither of these can actually change the deformity. The bunion can't go away with these treatments. Similarly, with hammer toes, padding can be made to straighten out the toe, but also these cannot reduce the deformity over time. When the pads are removed, the deformity comes back. With flat feet, one of the treatments is orthotic therapy. This is actually a treatment that would work. These orthotics change the angles by which you walk. Orthotics are like sunglasses. Sunglasses don't make your eyes change so you can see better without them, but they change the angles by which the light enters your eye. The orthotics work the same way by changing how the ground reactive forces hit your feet when you walk. So they help to correct the angles, but once you stop wearing the orthotics or the eyeglasses, the condition that you had the glasses or the orthotics for are the same, remain the same. So whenever you're wearing the orthotics, it's helpful, but once you stop wearing them, the condition won't resolve. So the conclusion is that just simple exercises and various modalities of conservative treatment, they help to correct the deformity, but they do not actually reverse the deformity. There are no exercises that can be done. So oftentimes, if the conservative treatments that are talked about, the non-surgical treatments, have been done, and there's still pain remaining, sometimes surgery is required to reduce the deformity, as well as some specialized orthotics to keep the condition from coming back, or to initially help the condition to keep it from getting worse. So if you're having any of these conditions or similar conditions, please don't hesitate to call our office and we'll take a look. As again, thank you very much. Take care and have a great day.